hear me, we'll see. But just wanted to cover a couple things. I talked to Elizabeth and thought it would be a good idea to um, cover some of the basics, just of how to use Medicare, what Medicare is, and just see if you have any questions after we go through that, and then also cover some of the how Medicare and Medicaid work together. So to start, my name's Adam. I'm a broker when it comes to Medicare and Medicaid things. Based in the Southeast, but grew up in the Northeast, so kind of all over the place. But today we'll talk about Medicare. We'll talk about what it is, the parts of it. I think most of you guys are already signed up, and I know open enrollment is coming up in October, so you're probably getting lots of mail, or lots of pieces of information and things like that. So just be on the lookout for those things. There has been some changes with the legislation, so there are some things that are kind of moving around. We actually haven't heard exactly finalized rulings on some of the things, so we can kind of touch on that briefly, but just keep an eye out for information coming in the mail and other things. So Medicare, as some of you might know, is a federally funded program for those that are 65 years of age and older, or if you're on Social Security disability or have ESRD. As some of you might also know, Medicare doesn't cover everything, but between the Medicare and Medicaid programs, they do try to fill in some of those gaps. Just so you have an idea of the workings of, you've probably heard, friends or family talking about the different parts or different letters of different things and trying to figure it out. So there are a couple different parts on the Medicare side. There's the Part A, which is, think of that as like your hospital care. So if you're going to the hospital, inpatient for things, having to stay in for a couple days or more, a lot of that stuff is going to be taken care of by the Part A. Your Part B is going to be more your medical insurance. That's going to be your primary care physicians, your specialists, outpatient surgeries, things like that. There's some other pieces to that, but we can kind of go into those details in a minute. And then the prescription drug coverage. That's going to be something depending on the legislation that might have some effect, but might not, just because of the Medicaid portion. But I would say kind of keep an eye out for that. So the Part A, like we said, is hospital care. There's usually deductible per occurrence, but a lot of that will be covered by Medicaid. And then you see it's also, you have 60 days covered, and then also you have 20 days of skilled nursing following a extended stay in the hospital. Your Part B, your medical insurance, this is the premium for this year. It will go up. It usually goes up every year. We don't know what the number is going to be for 2025, but again, if you're qualified for Medicaid, a lot of this is taken care of for you, as you know. But again, it covers your doctor's visits, lab work, x-rays, ambulance, emergency room, your outpatient surgery, and your Part B, as in boy, drugs. If you're not on Medicaid, then at this point it's Medicare takes care of 80%, and then you are in charge of taking care of the other 20%. So a couple things that, again, that Medicare itself doesn't cover, which includes dental, vision, prescription drugs, hearing, and help with long-term care. Now, that's again not including the Medicaid portion. That's again, we're just talking strictly about the Medicare stuff at this point. Um, Elizabeth, do you know if there's any questions at this point? I figured, we'll keep checking in periodically just to see.
Yeah, I know that Pamela said that everyone at the towers can see, but they're having a little trouble with hearing, so she's still working on it.
Okay.
So I don't think that there's any questions right now.
Okay. Do you want me to
But
wait a little bit longer, or do you want me to just keep going so you can record it?
I think keep going so we can record it because we can always play this back.
Okay. Sounds good.
Okay.
Um, so your prescription, when it comes to prescription drug coverage, that's a really there's been some back and forth with the legislature on changes that are coming up for 2025. So I would really pay attention to that. Um, I don't know exactly the numbers for what Medicaid is in DC or in the District of Columbia area in terms of what you're being charged for prescriptions, but there has been some movement strictly on the Medicare side of what the premiums are going to be, what the restrictions are going to be, and the out-of-pocket caps. So depending on where you are on the spectrum of getting extra help, I would just make sure you're paying attention during open enrollment. Um, just making sure that you're keeping an eye on that, and seeing if it has any effect on you or not. But open enrollment's always a good time to just review what you've got. The new plans will come out. Any changes that have happened from the previous years will have to be or should be approved by open enrollment's beginning, so that you can have an educated guess as to what it's going to look like for the upcoming year. I'm guessing most of you guys are already past the initial enrollment period, which is when you're either just turning 65 or finished working. Now there is a special enrollment period if for some reason you would no longer qualify for Medicaid. The timelines on that are something that you can look into if that is the case. And then again, open enrollment, some people will call it open enrollment, others will call it the annual enrollment period. That's coming up in it's October to December, October 15th to December 7th is the usual date. That can be a good time to just make sure you're paying attention. You will get inundated with mail. You will get, you'll see all the commercials on television. You'll see all that kind of stuff. You know, giving you ideas of different plans to sign up for and all these other things. But always talk to somebody you trust. You can ask me questions when the time comes, or if you have questions, we can always go through that stuff at that time to answer any questions you do have. The one thing I do recommend is always use trusted sources. So Medicare.gov, CMS, which stands for the Center for Medicare and Medicaid Services. That is the behind the scenes, the operators of Medicare. And they're going to be the ones also that will put out stuff. And I'll show you their logo in a minute, just so you know what it looks like. But they always have trustworthy information, more so than sometimes the advertisements and the enticements that you can get in the mail. So let's see, at this point we're going to switch over to a different screen here. Let's see, share. Okay, Elizabeth, can you see this new screen okay? Okay.
Okay, we have sound now. Thank you.
Okay, perfect.
Woohoo! Thanks, Pamela.
Who's
Do you
got, who's
guys
got,
want Adam to go back to any slides to kind of re-talk about anything that they
Yeah.
saw on the screen?
All of it.
all of it?
Okay.
Okay, sounds good.
All right. Thanks, Adam.
Yep. Hold on, let
Need
me
a
pull
room.
that.
Okay. Thank you. Hi, everyone.
So he's gonna go back.
Yep, I got it. How's everybody doing? Can you hear me okay now? All right, sounds good. So yeah, so I know you saw the slides before, but we'll just kind of review quick, just talking about the different parts of Medicare, just so you have an idea. You probably, more than anything else, just a little bit of education. You've probably had friends and family or relatives talking about, Medicare, Medicaid at different parts of, your conversations of getting together. And so this is more just to give you a better idea of what the different pieces are and how they all kind of work together. So we'll run through it briefly. There are different, we're going to talk about what original Medicare, the parts are, what the different parts mean. And then I'm assuming that most of you are already signed up, but in case, you come on and off of Medicaid, we'll talk about that as well. So Medicare is federally funded for those 65 and over. As some of you might know, Medicare doesn't cover everything. There are some things that Medicare doesn't cover, but I know Medicaid will pick up some of that stuff, and we can cover that briefly. And then we'll get right into the different parts. So Part A, you'll hear a lot of different letters when it comes to Medicare. Your Part A is just think of your hospital care, as long as you're admitted into the hospital for more than 3 days, and that's always an important question to have you or an advocate, one of your advocates ask when you go to the hospital, am I in observation or am I admitted? That has a big factor as to how the billing is, and so it just kind of shows them that you know what you're talking about, which is helpful. Oh. There we go. We're good. So Part A also covers the hospital. It also covers skilled nursing as long as you've been in the hospital for more than a couple days. Part B is, think of that as more your doctor visits, your lab work, your x-rays, ambulance, emergency room visits, your outpatient surgeries, and the prescription drugs that you have to have a doctor help you administer if you'd have to go into the hospital or into the doctor's office to get certain medications. That's what this Part B, that's what this Part B is referring to. And then there's a split, but with Medicaid, this is kind of doesn't really come into play. As you know, there are some things that Medicare specifically doesn't cover, but I know Medicaid will pick up some of these things. Medicaid is a state and federal partnership, so District of Columbia, there's some minimums that the Medicaid has to cover, but they can go above and beyond those pieces. And so that you guys have a good understanding of, maybe some of the other benefits that they do cover. And I'd mentioned this before, but I don't think you heard. So there had been some changes, some pretty drastic changes with prescription drug coverage in the last couple of years with caps for maximum out of pocket. I know that with Medicaid, that might not be the case, but I would highly suggest just kind of keeping an eye on that this year when open enrollment happens in, between October and December. Keep an eye on what your prescription drug, your evidence or your annual notice of benefits, kind of keep an eye out for that, making sure paying attention that there's no major changes to any of the benefits, just because there has been some stuff going on behind the scenes. We don't know exactly how it's going to play out yet, but I would keep an eye on that just to kind of make sure. It is an important year to be paying attention on that stuff. So there's different periods to sign up. You'll hear some of these thrown around, usually not in the correct context, but the initial enrollment period is when you'd first turn 65 or you first enrolled in Medicare. That's kind of, to my understanding, talking to Elizabeth, most of you have already been through this period. The special enrollment period would be something if you were coming on or off of extra help or Medicaid, you would qualify for a special exemption to be able to sign up for things that you wouldn't have otherwise during the calendar year. So just kind of know if you should get letters in the mail notifying you of these things, but just know that if for some reason you no longer qualified for Medicaid or you're coming off of extra help or something like that, you do often have options to relook at plans. And then the open enrollment period or annual enrollment period is coming up. That is usually October 15th to December 7th. That's a big time. You'll see lots of commercials on television. You'll get lots of mail saying, hey, sign up for this. Hey, sign up for that. It can be a little daunting. Excuse me. It can be a little daunting with all the information that you get that gets thrown at you. I would always recommend use trusted sources when it comes to stuff like that. So if you see Medicare.gov or you're seeing, from Social Security Administration something or the DC, Medicaid office, those things are always good resources that you can use as, steadfast and true, accurate information. Sometimes when you get these other advertisements, they will use red, white, and blue to make it seem like it's official, but it's not always the case. So just just make sure you're checking that. CMS is the organization behind Medicare. It's a government organization that runs the Medicare Medicaid system. And I have their logo. I'll show that to you. So in case you find or you're getting stuff from them as well, you know that is a government agency that is they're kind of the rulers of what can get put out there and things like that. So I think this is where we picked up last time. I'm gonna switch back over to, let's see here, the other screen. Okay. Elizabeth, you can see that okay? Okay. So again, we talked a little bit about the Medicare stuff. Now we'll kind of show you how they work in conjunction. This is more just definitions. The reason I have this page up is so if you can see, Elizabeth, can you see my cursor move? Bottom right-hand corner?
Yes,
Okay,
I
so, all right, so in the bottom right-hand corner, you see this CMS. That is one of the logos for the Center for Medicare Services. Actually, I can zoom in on that. This is the organization that kind of oversees all this stuff. And so that would be another logo that if you see that this is, a government agency that's got some oversight to make sure that what you're getting, the information you're getting is accurate and correct. Okay, so the dually eligible beneficiary, that is when you're qualified for both Medicare and Medicaid. There are some different definitions depending on, at what level. If you do qualify for both, it's called qualified Medicare beneficiary. And then in that instance, then, like we said, there was those deductibles and copays before, but a lot of that is now picked up by the local, state, the DC Medicaid office. Now there is different beneficiaries. Each one of you is going to be, you might be in a different class where you're going to get help with different things, but just kind of a note, if you do recognize this QMB, the qualified Medicare beneficiary, please note that it's Medicare providers can't bill you for services and items that they cover. So in case you get anything, you get a bill in the mail or something, always, double check to make sure that it's actually something that you need to pay. Sometimes they'll send you the bills even though, they don't really know, and they're just hoping maybe you pay something. And if you do, then that's fine. They'll, on to the next for them. So does anybody have any questions at this point? You chime in. If you feel free to interrupt whenever. I've got 2 little kids. I'm used to getting interrupted, so it's.
Pamela, maybe if someone at the tower has a question, you can kind of talk for them so we can hear.
Yeah, they do. They do. One person has a question. What was your question? Do you know whether there are any new changes for 2025 to the Medicare benefits?
Okay, so I don't know specifically for the Medicare Medicaid benefits. A lot of that stuff is still, they're getting approvals for things right now. A lot of that stuff will have to come out usually at the end of August or the middle of September. We'll see if there's any major changes. With that, there's a section at the end of this that we can get to that has some things, but if you can see at the bottom here, this is for June of 2024 because it's been approved, but we haven't seen the 2025 stuff yet. So that's where, just making sure you're really paying attention to when you get those letters in the mail, the annual notice of benefits letters, that you look, pull them out, read them, check them, have somebody else, maybe even at Capitol Village, look at them with you and review what's going on, because there possibly could be, but I don't know specifics as of right now.
Can you tell me the age? Because I know I'm not old enough yet. Can't
So,
remember what age you can qualify for Medicare benefits.
Medicare benefits is when you, go ahead, sorry.
I'm sorry, when should you apply?
Okay, so for Medicare benefits, you can apply when you're 65. You can apply 3 months prior to your birthday month of when you turn 65. Does that make sense?
Yes, got another question. What's your question? He wants to know, does United Health has anything to do with Medicaid and Medicare?
So not necessarily. So Medicaid and Medicare are a federal program that is run by the government. United Healthcare can provide health insurance to those that are either under 65 or over 65. They do have Medicare supplement plans and they do have Medicare Advantage plans, but they kind of run in conjunction with that. Actually, you know what? We're going to do this. This might help. 1 second. Where's the other slide? Okay, hold on. I'll pull something up that might help, just at least visually with that a little bit. Medicare.
If I can chime in too,
Sure.
The Department of Healthcare Finance, which is the DC Medicaid office, has
Yep.
a contract with United Healthcare to provide services to people who are eligible for both Medicare and Medicaid. And
Okay.
that may be what the gentleman is asking about.
Okay.
And there are some there are some known problems with the way that United delivers its services.
Okay. In terms of billing or compliance, or what, do you have some specifics or generalities?
Yeah, it's as far as I can tell, their case management services are not adequate to the number of people that they serve.
Got it.
And so we're seeing a lot of people falling through the cracks,
Okay.
and not getting the services that they're entitled to, and they're not being very responsible ultimately.
Got it. Do you know if that is like a Medicare Advantage contract? Or is it?
I don't
Okay.
know what the contract is. I only know that it's for people who are eligible for both Medicare and Medicaid. Pamela, can you confirm that that's what was being asked?
He said that's part of.
Part of it?
Yeah,
Okay,
that's part of it.
if they're having specific problems getting services from United Healthcare, we have a contact at DHCF who says they want to hear about it. So, just, Pamela, maybe just follow up on that.
DC finance company not answering the telephone. They put you on hold for 24 hours. I called them. That's in Monday.
He was saying
To call me back and they go.
he's saying the healthcare finance agency is not answering their phone.
Right. Okay, not surprised. Why don't you, I know Alex has a contact there. So Pamela, why don't you take down the information and send an email to Alex, and see if she can get an answer.
Okay.
For the gentleman.
Another question?
It's getting increasingly difficult. From the doctor, some procedures, X-rays, things like that. Position, I don't know. Why?
He said Mr. Kennedy said it's getting increasingly difficult to get referrals to doctors. From doctors for certain procedures and X-rays and things of that nature.
I see. So that's one of the issues with managed care, is that the way the managed care, as opposed to, there's different, and Adam, I'm sorry, I'm Judy. I'm the director of the village. I don't want to be, I don't want to be,
You're good.
You may understand this better than I do. I'm sure you do, but the difference between a managed care plan and a pay per service plan, and how you access different services. Did you want to, can you explain?
Yeah, sure.
that?
So and Judy too, for your point, that has been the lead times on referrals, and some of the extra benefits, the managed care extra benefits, have been a big sticking point with the Center for Medicare Services, Medicare and Medicaid Services. That has been some of the changes in the background, the legislation. So the CMS has been pushing these insurance companies to, again, be more responsive. Another big notice, and then I'll be interested to see how it's implemented, but a big change on the managed care side, especially if it's, a Medicare Advantage contract, this year's the first year, halfway through the year, they're going to have to send a notice to each individual with all the extra benefits they haven't used yet, which we think is a big win, because usually they will promise, oh, we have this benefit and that benefit, and you sign up for that, and they basically hope that you forget. And so CMS has mandated that these companies now at the 6-month mark start sending out letters that say, hey, these are the extra benefits that we offered. These are the ones you haven't used yet. So, we just need to let you know. So that would be something else too, of just kind of keeping, but yes, report all those, the phone call, the no phone call returns, the difficulty with referrals. The more that stuff gets reported, the better off as, the Medicaid, the DC area stuff they do. It might seem like a drop in the bucket, but it does add up when it comes to that. So if it is managed care, if you have on your card, it says PPO, then you're not necessarily going to need referrals for certain things. If you see something like a managed care or HMO, then yes, it is always going to be, you're going to have to see your primary care physician or call in and ask for a referral for certain things, which is, one way where they keep you in certain networks, but it also can be very difficult. Like you said, it can be very difficult to try to get the care that you need in a timely fashion. But yes, it is a hassle, but the more you guys can report those things, the better off, it'll be for everybody, because CMS does pay attention to things like that. So.
And Mr. Kennedy, I would just say, also call Alex and let's see if we can't do some advocacy for you, with the insurance. We can talk to the insurance ombudsperson or the, so many of these things are individual, right? I mean, we can't solve them as a group, but if there's something that you need help with, please let us know.
Bring it back again. When that paperwork do come out, it's gonna be too much work for this one individual. I'm talking about like Pamela Johnson. So she's gonna need some help. This is 204 apartments in this complex. So everybody gonna come down and ask her question. Send Alice over here so that she can help her out. But she only one person. She ain't been has her own question. Overwork, no pay.
Don't say that.
You hear that?
You've got an advocate. Good for you.
Any other questions at this point, or should we keep going?
Is there a cost associated with having a PPO? Because I know that allows you to go to any provider without having referrals. So what's the difference? Is there a cost associated with that?
For certain plans, no, it would be similar to the managed care plan. I can't talk specifically just because of I can't talk specific costs and benefits of plans just for compliance purposes. There's legal stuff that I have to comply with in terms of getting papers signed by you guys. But it is something that is usually there's not much of a cost difference. It's just the cost sharing is different. In generalities, that's, across the country, that's kind of how I would explain it. But it is something to consider. Sometimes you just look at it and it just letters on the piece of paper. But again, with a little bit of education, hopefully, that knowing that, managed care, what HMO means versus what PPO means, just trying to make an educated decision based on, what you need, not what, so-and-so told me that this is what they have, so that's what I'm going to get. Everybody has their own care. Everybody needs their own things. Everybody's not in the same situation. So again, it's a lot of it is education, but some of this is the most important healthcare that you'll get in your whole entire life. So
yeah. I do know, I do believe that the United Healthcare HMO plan is the designated plan, is the only contract that DC has, I think, for people who are eligible for both Medicare and Medicaid.
Got it.
So, but I think hopefully with the increasing number of problems we're seeing, we'll be nice to be able to provide some choice.
Yeah, right. Yeah, and you guys are in a unique situation where you've got a lot of people, but it's some other states, they're working on networks for the whole state, and so it's that I can imagine plays some part of it. But yes, if you can get on the horn with them, the more you can have complaints and stuff like that, because they have each one of these companies and each one of these plans has what's called a star rating, which it greatly affects how they are, or they're standing with CMS. So if they do not have a great star rating, CMS is going to drastically cut their pay. They're going to relook at their contracts and things like that. So that is where it is important, especially with the managed care, the PPO stuff. So those complaints are important in terms of, I know it takes time, and time is, sometimes your most valuable resource, but by banding together, I think you guys could definitely make a change, or at least, make sure it's on their radar. All right, we'll keep going.
Got another question?
Go for it. Let's go.
You were talking about the 6-month letter, or whenever that letter comes in, to tell you what benefits you have yet to use for that particular year. Is this something they've already started, or something that they're going to start? Because I've never received that.
Pamela, can you just repeat the question for me? I got bits and pieces.
Yeah, I think you already answered the question about the new plan benefits coming out in, you said October, right?
Yes, that stuff. Yeah, all the new stuff should come out. You should either get it's called an annual notice of benefits, or the new, if there's new plans or United Healthcare has made any changes to the Medicare, Medicaid plan, that stuff should come out. They're getting approvals now. Let's put it that way. They have all filed their plans that I know of, and those changes should be coming out in the next month or two. They're supposed to give everyone enough time to look at it, and so that if you do need to make any changes during the annual enrollment period, you can. So be on the lookout. That stuff should be coming out in another month or so, and then just kind of try to compare and contrast.
Any other questions?
All right, we'll keep rolling. So again, this is kind of just some general information, and I can send this to Elizabeth in case anybody wants to, have this or look at it in more depth. But it just, some of the services that are covered by Medicare, it helps cover a lot of this stuff, but then Medicaid will help pick up a lot of the stuff that, states must cover mandatory services through their Medicaid program, which include physician services, inpatient, outpatient surgeries or services, lab and x-rays, nursing care facilities, medication assisted treatments. Now they may cover dental, some diagnostic screenings and other preventative things, needed medications, physical therapy. That is a state by state, or, DC, that's something where United Healthcare can kind of move those benefits around, but make sure you're paying attention to whatever those, those benefits are. And this is, I think, where possibly if those rules apply also to the Medicaid programs, that you should get, if there are extra benefits that haven't been used. But I'm going to get an answer on that in terms of, do the Medicare, Medicaid programs also fall under that 6 month notice? Let's see here. I'm gonna go, where's the other piece? This we already talked about, all the benefits. There's just one little piece I wanted to make sure that we got to. Okay, so here's something that's, very important. We kind of touched on it before. If you're fully qualified for both Medicare and Medicaid, all original Medicare and the managed care, which is also called Medicare Advantage providers and suppliers, they're not, they can't charge you for any services that are covered under Part A and Part B. So here at the very bottom, many beneficiaries are unaware of the billing restrictions that are imposed on either the doctors or the service providers. Or, you can get concerned that if they send you a bill, you're going to damage a relationship with whoever the doctor is, if it's somebody that you like. And sometimes just pay the cost sharing. Others may experience, just not happy or, distressed, thinking, hey, why am I getting all these bills? I'm not supposed to be getting these bills. Make sure you always ask the questions, why am I getting this? This is my coverage. Can you please run it again? Unfortunately, and oftentimes you have to be your own advocate to kind of stand up and say, hey, look, I'm not supposed to be getting these bills. Like, what's going on? I need you to rerun this again. That is a very common occurrence, is to, asking your doctors or healthcare providers, hey, I'm on Medicare. Hey, I'm on Medicaid. This is my plan. I'm not supposed to be getting these bills. I haven't gotten these before. Can you please run it again? Or, tell me why, give me a written notice as to why I'm getting these and why I need to pay these. So if whenever you can, ask for stuff in writing, just that way you have something. Again, if you can't get somebody on the phone, you've got some proof to say, hey, well, they told me that this is what it was. And so again, if you need to, file a claim or something, you have, something, some grounds or something in writing to go by. So trying to think if there's anything else. No, with that, I mean, that's really, I think the major pieces that to cover today. I think, again, more questions, happy to answer any more questions. And then also I'm gonna, try to get some more information as to if I can find out more about that United Healthcare contract, exactly what kind of contract it is. And
I have
then
got another question.
absolutely, what is it?
In terms of plans, and case workers, which plans have case workers assigned to them?
That's a good question. I don't know if any plans, I mean, United Healthcare is one of the biggest companies in the country. I don't know if they all specifically have case workers, or how they kind of manage that on the back end. I mean, maybe Judy, if you might have a little bit better experience with that as to your experience with United Healthcare specifically.
The only thing that I know is that they do have case management, and that they are supposed to bump people up to a higher level of case management if they're, if they are hospitalized, or if they have, if something happens where they're going to need more attention.
Got it.
It doesn't seem to be happening as consistently as it's supposed to. So if your case manager is falling down on the job, I mean, if you aren't United Healthcare, if your case manager is falling down on the job, that is grounds for a complaint, and to make sure that you're at the right level. Especially if you're going into the hospital, or if you're just out of the hospital, or if you're in rehab or something like that. So.
Okay. Yeah, I know there are, if you have certain medical conditions, there are something called special need plans that are specifically for, if you've got certain health conditions. And in that case, then I know there are some differences with the case management, but unfortunately, I don't know the DC United Healthcare contract, all the ins and outs. So I can't speak specifically to, do they have case managers or anything like that? But that's a good question. I can see if I can get an answer to that.
Hi, Adam. This is Cassandra at Capitol Hill Village.
Hi, Cassandra.
Hey, Adam. I was wondering, there was a slide in the beginning with the Medicare and Medicaid Basics, and it was from the Medicare Learning Network. I noticed that it had a lot of links directly in the publication. Is it possible to like receive like an email or something directly to that publication, like explaining the benefits? So it's
Yes.
like, okay.
Yep. I can get you, what I can do, I can get you, I'll get you a copy of both of those PDFs. One was the Medicare, Medicaid Basics, and then the other one was the beneficiary dual eligible facts sheet. I can get you copies of both of those. I can email them to Elizabeth so she can send them out. And then, yeah, you can have access to all those links of, what's included, what the different, and then you can have access to all the different links that are in there. They're all active links.
Thank you.
You're welcome.
Adam, so much. I think that if there are other questions that come up from people who are watching from the towers, they can let Pamela know and she can reach out to me and I'll touch base with Adam. Yeah, Judy.
I have a question, Adam. What is
Sure.
what is the best way to make a complaint with CMS about services? Is there, does each individual have to do it themselves? Is there a way to, to communicate as a group? Is there a website where you can go and say like, this
Yeah.
stinks?
I don't know, the group question is a good one, because if you guys could all somehow get something together, but I don't know, I've never actually had that question before. That's a good question. If there's a way to do a group complaint or something, but usually it's just an individual. I can get you that information of at least the numbers that I have. I'm trying to see if I can. But usually it's it's just, you're filing it. You can either do it online or over the phone, and you're just kind of putting in your information saying, hey, this is who I am, so they know that it's a viable complaint, and so they can kind of do their research and then kind of just filing them in from there one at a time. I know they've got paper forms, but then also online. But I can get you, so I'll send you the PDFs, and then I'll also get you the complaint.
And do they have any authority over the DC Medicaid office? Because I know some of the issues that folks are dealing with have to do with the fact that that our Medicaid office is not holding their contractors accountable for not delivering the services that they are supposed to deliver under the contract. And so,
You're right.
Is that something that CMS can actually help our residents with? Will they, or are they just going to say like, oh, this is a DC issue,
Yeah, because I don't know exactly how those lines are drawn in the sand in terms of, because I know that Medicaid is usually enacted at the state level. It's the federal and state partnership. I don't know how much oversight, even though it is CMS stands for, Center for Medicare and Medicaid Services. I've never really seen under the hood in terms of, hey, they're really putting their thumb on them because they're not doing what they're supposed to be doing. Usually we hear more about CMS, putting their foot down when it comes to the insurance companies, but I don't really know how that would enact, with each state with their Medicaid. Because I can imagine some of it just has to do with funding. But I'm trying to think. I can ask. I do have someone that's more on the legislative side that might be able to answer that. Here. And Medicaid compliance.
And then there's a question in the chat.
Yeah.
Oh,
I
wait,
don't know
let
if
me-
you can answer this, Adam, but somebody's wondering, why is it easier to get a wheelchair through their insurance rather than a motor scooter?
Yeah, I don't know. That's a good one. I don't.
Probably because it's cheaper. That would be my guess. Insurance companies
Yes.
like
They'll
to
pay
save
for
their
whatever.
money.
Yes. Yeah, I don't. That's a good one. But my educated guess would be that it's yes.
But I feel like that's a good example where it's easy to, their first answer is going to say a wheelchair, and they're going to hope that you accept that and give up. But if you have the time and the resources and the support to keep pushing,
Yep.
hopefully you can get your motorized scooter,
Yep.
but they're not going to make it the easiest for you. And that's the problem.
And
Yeah.
we've seen that too on, and there has been things being talked about from CMS with some of the managed care things where you send something in and they deny the first one, and then you have to send it in again, and then the second time they approve it. So it's unfortunate. It has been, I know it's kind of on the top of the list when it comes to prior authorization. I know CMS is really on the companies to make sure that, hey, we need to do you guys need to do a better job of vetting this stuff. And if it's needed, we don't want clients and customers and our citizens having to go back twice and three times to try to get some approved when it should have been approved the first time. So again, know that, sometimes maybe your first answer isn't always the correct one or isn't always the final answer. It's like, what was who wants to be a millionaire? Is that your final answer? Nope, that's not my final answer. I'm going to ask again. You just keep asking and keep asking. So,
Yeah.
but I know Elizabeth and I, and, some other people at the village have talked about this before, but unfortunately, sometimes you have to be your own advocate of saying, hey, no, this isn't right. No, I'm going to go ask again, which is unfortunate, but sometimes that's just the way it's going to have to be. So,
Yeah. Well, Adam, thank you so much for taking the time. And Pamela, thank you so much for
yes.
troubleshooting the volume and sticking with it. So if anything comes up, let me know and I'll be in touch with Adam. Okay, thank you, everyone. Have a good
Thanks everybody
afternoon.
for listening.
Okay,
Thank you, Adam.
thanks, Adam.
Guys.
Okay, bye.
Say bye.
Thank you.